Welcome. Now we are very, very honored to have our very first panel in Convene conference after this fantastic keynote by Anish Chopra. And our panel that we titled is Reaching the Healthcare Consumer, and it will be moderated by my dear colleague, Maiza Reitmeyer, whom I welcome. Quick introductions. Maiza Reitmeyer is the Vice President of Commercial Marketing for the Cardiovascular Diagnostic and Services business at Medtronic. In her more than 19 years with Medtronic, Maiza has led initiatives and teams responsible for new business growth, global market development, product launch, and commercial and operational strategy. She brings experience in finance, sales operations, marketing, business development, and strategy with a consistent focus on the consumers and patients. And Maiza is a passionate advocate for career development and serves as an active mentor for emerging leaders at Medtronic, in addition to serving on various boards, including the Carlson School's Medical Industry Leadership Institute, National Industry Council, and the American Red Cross. Thank you so much, Maiza, for joining us and for moderating this fantastic panel that I'm so much looking forward to. Thank you.
Thank you so much for that very, very kind introduction, Pinar. You also neglected to mention that I'm also a very proud Carlson alum. So delighted to be here and to introduce you to this phenomenal panel of speakers that we have today, each of whom is playing a different role in helping drive adoption of healthcare, and with this lens on the healthcare consumer. So let me waste no time in introducing you to our wonderful panel. I'll start with Sally Burke. So Sally is the Vice President of Health Integration for Best Buy, where she leads integration of newly acquired companies, building capabilities to grow the health business. Sally, I'll have you say a word of introduction to our audience.
Thank you, Maiza. Thank you all for inviting me to this panel. Super excited to be here and to be talking about this within Best Buy Health and the integration efforts. What we really want to do is enable the technology in the home more than ever for the health of all of our patients, our customers, our families and friends and so forth. So super excited to be talking about this today and look forward to the conversation.
I love it. What a wonderful vision. Next up, we have Janali Desai. So Janali is Walmart's Vice President of Bundled Solutions, where she leads the development and operational execution of integrated offerings for large customers, such as self-insured employers, payers, and health systems. So Janali, welcome to the panel.
Yeah, thank you for it's great for being here this morning with this group. Excited to be here. I would say that, I'm a pharmacist by training. And I was born and brought up in Kenya, and my passion for consumer healthcare and community-based healthcare started when I got to see many folks, unfortunately, die from diseases that were very preventable, but also treated for diseases that were treatable. And just the reason of why we should be listening, giving customers and consumers ability to manage their healthcare is critical, and it's a pleasure to be here to speak about how we do that.
Yeah, and I definitely am looking forward to hearing more about that as we get into our discussion. And last but not least, we have Arvind Sastry. So Arvind is a partner in McKinsey's Minneapolis office, and his primary expertise and interest is in the application of technology in healthcare, with extensive experience in the medtech industry, working with healthcare providers, med device makers, and governments on the implications of healthcare reform on consumers. So Arvind, welcome to the panel.
Thank you so much, Maiza. Yeah. I should have written some of that down for the next time I introduce myself. Really appreciate being invited to be on this panel. I'm hoping to learn a heck of a lot from both Janali, Sally, and of course from you as well, Maiza. As you mentioned, I do a lot of my work across the healthcare value chain, whether it's payers, providers, and tech companies. I'm hoping to share some of the perspectives from that, in particular on how the healthcare consumerism landscape has evolved in the last couple of years and the opportunities and challenges ahead. So really excited to be here.
Well, that is a perfect segue, and I think we'll launch right in with that topic as well. So I'd love to hear from each of you, your perspectives on how you think the landscape has changed for consumers. And Arvind, let's start with you. You have a pretty broad perspective on this from your research work at McKinsey. So if you don't mind sharing a few thoughts on that.
Sure.
To Sally and Janali.
I don't think there's any doubt that the pandemic has changed consumer behavior in healthcare. I think at the onset of the pandemic, both physicians and patients embraced telehealth. in April, when we ran a bunch of surveys, the number of virtual visits was a stunning 78 times higher than it was just 2 months earlier, and accounting for nearly 1/3 of all outpatient visits. Of course, this had a lot to do with the fact that in-person visits were less possible. What this meant was, from a provider standpoint, you had health systems, you had independent practices, behavioral health providers, all of these folks rapidly scaling up their telehealth offerings to kind of fill the gap between the need of the patients and the fact that they were seeing so many canceled in-person care appointments. From a regulatory perspective as well, you saw reimbursement kind of opening up for temporarily for a bunch of telehealth services as well, which always tends to change behaviors. If you fast forward to about May of 2021, you will see that about 88% of consumers that we spoke to said that they had used telehealth services at some point over the course of the pandemic. Physicians also felt dramatically more comfortable at least offering those services. 83% of those we surveyed, kind of offered at least some form of virtual health services, compared to a mere 13% in 2019. Two things I want to highlight. I think it's not limited to just certain demographics. What surprised us to an extent was the fact that the trend towards adopting digital and virtual healthcare is not really just limited to your younger consumers. Baby boomers, for instance, reported preferring digital healthcare at higher rates, in fact, than the general population. May have a lot to do with the fact that they didn't want to be exposed, given their health conditions, to in-person care settings. It's also not likely a one-time thing. So we continue to survey patients, and what we're hearing is about 40% of those that we surveyed, as late as about 3 months ago, said they still believe they will continue to use telehealth post the pandemic. In fact, some, more than 50% of them are saying that they actually prefer or are more satisfied with their telehealth or their virtual health visits than with in-person appointments. So obviously, huge amount of impetus given by the pandemic, and then, as I mentioned, providers responding a certain way, regulators responding a certain way. But I think that shift in consumer behavior is very real and likely sustained.
Yeah, that was definitely something that we noted, was both, a dramatic increase of the willingness to accept telehealth visits for both physicians and for consumers. I mean, it was a sea change, and candidly, I hope it remains a durable trend, because it opens more opportunity for innovation, which are some of the things we'll be talking about today. Sally, do you mind sharing your perspective on what you've observed from the Best Buy lens?
Yeah, definitely. And Arvind, too, when we're having to adapt technology into this, as far as our healthcare, our own healthcare, change is hard, and change isn't always accepted. And I really think that the pandemic forced us all to change and think about things differently for our own safety, for our family safety, and so forth. And so by doing that, we had to adapt new technologies, whether it be the providers and the health systems, the customers, the patients, the caregivers, and so forth. And so it really forced us into change that might have otherwise taken a lot longer for us to get there. The other thing I wanted to note too, just around this, the other forcing factor was the amount of capacity we had in the hospital beds. And so it's like, the sooner we can get people out of the hospitals, the better. So if we needed to hang on for monitoring their health, their vitals, and so forth for hours or days, we could do that at home through technology now, which really wasn't too prevalent before pandemic. And now it's everywhere. You see it even show up on TV shows and so forth. It's become mainstream. And so now it's more accepting to the public. Even when they start seeing the home monitoring devices on their favorite TV shows, they're like, oh, I could do that. I don't have to spend 4 more days in the hospital just being monitored for vitals and so forth. So even though the pandemic was horrible, it brought on this need, this hardship to change for everybody. And that's what we get really excited about, to be able to enable that technology in the home even more so, and that it's more accepting from the consumers now, based on what we've all had to go through and how you see it show up through mass media and so forth now too. It's much more acceptable now that we've gone through it.
Yeah, thank you so much. Now, Janali, I'd welcome your perspectives on this from Walmart, who, historically we wouldn't have thought of as a healthcare provider, but you're taking a very active role in shaping who's getting care and who's delivering it. So I'd turn it over to you here.
Yeah, I think I would agree everything with Arvind and Sally say. The couple of other factors that I would add to this is that we've got 4,700 pharmacies today in 4,700 communities. 4,000 of our pharmacies are in medically underserved, HRSA designated medically underserved areas. When you have access issues in the communities that you live in and practice in, the way that you deliver care and the way that care is received changes. COVID, both from a testing perspective and vaccine availability perspective, really amplified the role of those community providers that typically were not necessarily as embedded in people's care journey like pharmacists. Everybody has a relationship with the pharmacist, but their expectation and the depth of that relationship with their pharmacist really got amplified. And you saw them seeking information. So as a provider in some of those medically underserved communities, we had to provide education, content. Some of it was delivered digitally, much of it was delivered digitally, some of it was delivered physically. The other factor I would add is the caregivers and their needs. Many of us act as caregivers. And before we went into lockdowns, we were able to be available with our elderly parents, our college kids, depending on what journey in life you are in. And during COVID, that wasn't readily available. And so that role of caregivers and the tools and the gaps that were available also got amplified because of the connectivity that folks were seeking during the time. And so you see that that trend get amplified in a lot of conversation around how do caregivers get to participate in more meaningful ways in the care team as we go forward. And many of them put analog solutions together in how they were connecting with providers and the care teams virtually, which wasn't obviously as efficient as it could be. But those are the two other factors that, Amaza, I would share in addition to what my panelists here have shared.
Yeah, that's a perfect segue to the next topic I wanted to cover, which, just thinking about what are those innovations that you saw delivered or that you had to develop in order to deliver care in a new way, whether that was incorporation of the caregiver, new sites of service, this changing relationship with the pharmacist that you mentioned. What were some of those innovative approaches that Walmart and then Best Buy took? And then Arvind, I'll come to you to close out this question on the big picture trends that you're seeing across the spectrum. So Janelle, I'll stay with you for a minute on this.
Yeah, I would say that there's three things that we've learned. And I think this is some of the learnings. They just got accelerated during COVID. I think these are things that the health system have known, providers have known, consumers have been demanding and seeking. So they're not probably new, but they just probably got amplified. And we sprang into action and accelerated in this direction. One is around changing models of where care is delivered, Amaza, and then omnichannel is critical. You cannot give a person the option to only digitally connect or to only physically connect. Our life journeys and the complexities of what we deal with allow us and want us to. We saw that consumers want to be able to connect how and where and when they want to connect. And giving that optionality is critical. And we believe that, and we've seen this, we believe that it is really important to provide omni-channel care, even in healthcare, just like retailers do it, the banking industry does it, many industries that have come ahead of us. Also connected to there in terms of the where, it's important to note is that healthcare will always remain hyperlocal. And the trust and the connection with the community is going to continue remaining critical, regardless of virtual or physical. Healthcare is very hyperlocal, both from a consumer demographics and mindset and cultural aspects, but also provider systems that are available in each community vary, and therefore it continues to stay hyperlocal. So that's point number one. The who is delivering care is also starting to change, and we saw that also get accelerated during COVID. To Sally's point earlier, because there was availability or shortages or overtasking happening in certain parts of healthcare, it pushed others to be engaged and leveraged to provide the care and the gaps. Like pharmacists played a huge role. I think 2 out of 3 COVID vaccines were delivered by pharmacists in the last 2 years. Much of the testing was done by pharmacists. Community health workers played a significant role in supporting the folks getting vaccine. vaccinated and creating the comfort level that was required for folks to trust vaccinations and testing. And then the third thing I would say is we also learned about the disparities that exist, right? And so the models have to account for the social and behavioral needs. Clinical only makes up 20% of one's health outcomes, clinical care does. Yet we as a system and as a society spend significant amount of our resources around clinical care, and it only makes up 20% of the outcome that one can achieve. 70% is from the behavioral and social factors. And during COVID, we saw that. We saw how critical under the social needs were and behavioral needs were to close the gaps. We also saw disproportionate outcomes with the consumers in that period. And so that has also accelerated a change in the health system, and not only Walmart, but many other organizations out there that are investing in the social and behavioral aspects that are critical to drive better outcomes.
Wonderful. Thank you. There's a lot to unpack there. And so I'm eager to continue this conversation. Sally, I would be interested in your perspective on this. Kind of what is the innovation or the trends that are driving the shift, that are enabling the shift to this consumer-based healthcare model?
Yeah, great. And all fabulous points, Janali. That was great. I think just to further add on to that is just around the information that we have at our fingertips today, and that we can continue to gather, and we can become more predictive. And so if we can actually start, for example, measuring fall risk, where somebody might be having some issues with their gant or their walk or whatnot, and be able to have some kind of alert so they don't fall and break their hip or have other serious issues. If we can start seeing some of those alerts within ourselves and have triggers and have notifications sent out and so forth. So being able to use information that's gathered, data points that are gathered, to saying something is not right here, why don't we check into this kind of thing? And so that predictive technology that we can use going forward is going to be so much more beneficial, and be able to gather so much more insights to the patients, to consumers, to humans in general, kind of thing. So I think I would add that point, but Janali had great points through that, but just the data that we have at our fingertips that we can start gathering, that we can start improving upon the health of all of ourselves, is hugely important, and seeing a lot of benefits come to fruition there.
Yeah, and again, I'm just moderating, not a member of the panel. I'll tell you, this is an area we think a lot about, is how can we better leverage the data that we have from the devices that we use to predict risk and get an appropriate alert to a patient or a physician at the time of need, without over alerting, meaning without sending false alerts, false information, sort of crying wolf with the data. So that it's a challenge that we're all working to solve together.
Yes, great points.
Yeah, good. Arvind, I'd be interested in your perspective on this from a
I think,
yeah,
the panel has already raised a bunch of really vital trends that are, innovations that are helping this shift. The investment on patient-focused omni-channel solutions that both Janali and Sally mentioned, the care team role evolution, the predictive technology, right, the advancement there to be able to actually make sense of all of this data. I think all of those are absolutely valid. Just a few refinements on that. I think the actual availability of the data itself, Anish raised this in his keynote as well, just the fact that there's new regulations that are pushing for transparency in pricing, that are sharing large quantities of claim data from Medicare and Medicaid, that then makes that available to innovators in the space to actually be able to analyze and come up with more novel solutions. The fact that there's patient-generated data from all of these smart devices as well that's becoming available, I think all of those are enabling those insights that will help us identify value and manage care. So that availability is one thing. Then the fact that this pushes for interoperability, right? Previously, it was always hard when you switched a provider to actually have your records move with you. And now with regulations pushing for that digital interoperability, you can see providers and payers allowing more rapid data transfer. And that then makes it available to, again, those innovators to be able to do something with it. So absolutely on the data front and on the technology front, I think though fundamentally what is necessary and what I think will continue or sustain this change is going to be the alignment of interests, right? If you can see your payer, your provider, and all of the folks on your healthcare value chain on the same side in terms of sharing the risk to an extent and also sharing in the value that is being created from these innovations, you will see more sustained change. So the shift to value-based care models, advanced payment models that allow providers to actually take on risk and therefore be more incented to change their behaviors is going to be a vital aspect as well.
This is an interesting point because this discussion around a shift to value-based healthcare has been on the table for, the better part of a decade and has still proven elusive for a number of reasons. I want to use that as a launch point to pivot our discussion to some of the challenges that we're each seeing in realizing this opportunity, whether that be because of information access, because of reimbursement models that may be challenging, availability of care. So I'll ask each of you to comment on where you see the challenges in realizing this opportunity. And Sally, I'll start with you.
Definitely. There's no shortage of challenges in this area, of course. There's, I think, within the having misinformation out there and having a lot of our patients and our consumers have to really self-guide themselves. There's a lot of good information out there. There's a lot of misinformation out there of what's needed. And so that's one. So there's this balance of regulation, compliance, government, and so forth that we need to partner more with than we have. And I think that we need to bring the next phase of what this is around information and regulations and so forth to make sure that we're ensuring the safety of our consumers, our patients, but still being able to give them as much information as possible. So how do you do that in the appropriate way? How do you do that that is not overbearing and over context, that doesn't bleed in with misinformation that's out there and so forth, because it can be quite subjective at times as well. And so I think that's one of the biggest challenges that we're facing right now is how do we start really in that arena and driving change in that space.
Yeah. And who is appropriate to drive that change? Right.
Exactly.
Lots of open questions here. Janali, what are your thoughts on this?
Yeah, I would say, and many may not know this on the call, but Walmart's been in the business of healthcare for 40 years. And we primarily are known for our pharmacy and optical business because that's the ones that we have that largest at scale. The other accolade that we have is we've experimented with way too many models out there with services, different types of services, different business models with healthcare services. Given we've got 4,700 locations at any given time, there's probably 20 or 30 experiments that we're doing in healthcare in 2 or 3 locations, at least at minimum, and 2 or 3 communities. You learn a lot when you do that. I've been with the organization for a little bit over a decade now. You learn a lot from that. And I would say I would probably put a quick highlight and an asterisk on what Arvind said. Alignment of incentives is really critical for us to achieve the innovations that we need to achieve. And what that means is that everything from provider to payers and all in between have to be aligned. And reimbursement models or alternative payment models are going to be critical. Value-based care, we've seen, if you follow many of the organizations that practice in value-based care, you're able to see the value that they create, not only for the customer based on the outcomes that the person is able to achieve holistically. They also have an incentive to participate in the social needs, behavioral needs, clinical needs. Typically in the fee-for-service model, you hone in on the clinical aspect because that's what that is what you get reimbursed for. And you're not incentivized to understand, why is this person having uncontrolled diabetes? Is it because they have food insecurity issues? And let's say you do find out as a provider that they have food insecurity issues. It takes 20, 30 minutes to refer them somewhere, make sure you follow up, ensure that they get the care that they need. Well, most of our healthcare system is not incentivized and doesn't have the administrative bandwidth to be able to provide that level of support, right? And so I believe that one of the most critical challenges, and this is why I'm excited about what we're seeing in the Medicare Advantage space, and the acceleration of the Medicare Advantage space is around value-based care. And there are many, including us at Walmart, that could create acceleration in the space. And so hopefully it doesn't remain elusive, Amaza, in the coming years, as many more start participating in value-based care. And at Walmart, we have food, for example, we're the largest grocer. We have achieved the ability for us to have the high quality, lowest cost food, fresh food. Where we haven't been able, we probably have some work to do is reaching communities that don't have Walmart in their neighborhood. And those are the communities that probably are being impacted with food insecurity. And so we're now starting to connect the dots between our health services offering and some of the food and other social needs that Walmart as an enterprise has. And how do we start getting local with those issues and not just coverage in a particular community, because it takes 5 bus changes to get to a Walmart, for example. And we're looking at innovations across South Africa and some of our other countries to understand how we improve that last mile delivery into the urban areas that are impacted with some of those social needs.
Yeah, I have so many notes here on things I want to follow up with on you as we continue our conversation. I love this this challenge that you're raising about last mile delivery of things as simple as food, and thinking about the role of food and high quality food in healthcare. So anyway, we'll come back to that assuming we have some time. Arvind, I'd be interested in your perspectives now on the challenges that we're facing, that we have to overcome through innovation.
Yeah, no, I think we talked about it. In my mind, I continue to believe that the alignment of incentives is a big one. Let me just bring that to life a little bit, right? I mentioned, of course, the fact that you've got patients who are ready and willing to embrace virtual and digital health. They see it as more convenient. They see it as sometimes even a better experience. What's interesting is that the picture on the physician side has actually evolved, even over the course of the pandemic. You have 2/3 of the physicians who will admit readily that yes, patients will absolutely find virtual health more convenient, but then only about 1/3 of those physicians actually say that they find it convenient for themselves. This was actually something I put in the chat as well. That perception is going to lead physicians to rethink telehealth, right? A number of folks that we surveyed towards the end of last year said they expect to return to a primarily in-care delivery model over the course of 2022, and they would recommend in-person over virtual care. Now, part of this has to do with the fact that physicians still need to understand how best to integrate their in-person and their virtual health model. But this is also in part driven by how are the incentives going to be aligned so that physicians can invest in the right set of technologies to make that care delivery experience kind of seamless across both your telehealth as well as your in-person care needs. So again, not to belabor the point, but you will see these massive shifts that have happened as a result of the pandemic, changing what consumers expect. But unless you align incentives for the delivery aspect, you will not have providers be able to keep up with those demands.
Yep, yeah, you are absolutely right, and raising a number of great questions. There are also phenomenal questions coming in from the panelists, or excuse me, from the audience for the panelists that we'll get to in a moment. So before we do that, though, I just wanted to get each of your thoughts on, what will you do? What do you think is the most important thing that you will be doing or leading to overcome some of these challenges and realize the opportunities for consumer-driven healthcare? What are you driving forward? And what will be needed in the future to realize these opportunities? So I don't know, Arvind, let's stay with you for a minute, and then I'll go to Janali and then to Sally.
Sure.
You're on a roll.
I think Janali touched on some of this. I think in my mind, the vision for consumer-driven healthcare meets the needs of the whole person health, not just clinical health, as Janali noted, right? You're thinking about, if you think back to the pandemic, it highlighted the need to focus on whole person health, address behavioral issues, social and economic vulnerabilities in the healthcare system. So I imagine that is a big part of the vision for the future of consumer-driven healthcare. I do think that it's going to be vital for all of the stakeholders, whether it's the Best Buys, Walmarts of the world, or the providers, or the payers, or the government, to help consumers make better informed decisions. So more understandable information, less surprises. None of us has mentioned the high cost of healthcare and how much of that is borne by the least able. I do think that is a vision that I see for the future of consumer-driven healthcare, where that information is available, so you make more informed decisions. I think the notion of being more local and also more personalized, the enhancing that engagement in healthcare, where personalized healthcare not only improves the experience, but more importantly, I think it improves better outcomes, right? It leads to better outcomes. So that would be another thing that, innovation needs to be leading the way there. And then I mentioned that delivering a seamless experience. It's not going to be an either or. I think the consumer-driven healthcare will have to live almost as part of this broader healthcare delivery ecosystem, and then creating that seamless experience for the patient, where across health journeys, across coverage transitions, I lost insurance here, I gained insurance there, or I was in person for my initial set of visits versus I'm going virtual for my post-operative care. That seamless customer experience is going to be a huge part of where I think innovation will play a role. And in my mind, if all of this is done right through the right set of incentives, you will lead to eliminating waste as well. Not only will you have better outcomes, but you will bend the cost curve too.
If you figure out how to deliver on that promise of a seamless experience, that will truly be a miracle of healthcare when we get there. That has been a challenge for sure. Janali, I'd love your thoughts here.
I would just say everything Arvind said. I mean, there's really nothing else to add to that. I think I actually don't think it's difficult. If incentives are aligned, it is a mass change. But at the end of the day, I always say that, and many of you who are in the audience here, if you follow the money and you follow the people and listen and hone into that, you can get to the bottom of the most complex problems. And I truly believe what Arvind just outlined, every aspect and every element of it is critical to the vision that we have and what we all deserve as consumers of healthcare, and our families and our neighbors deserve. And if the incentives can get aligned, it is very possible, and it's not as complex. And I think every one of us will see it, at least I'm hoping I'll see it in my lifetime, as I'm living and breathing still. And it's possible. Value-based care, where it's working, you do see the magic of it. Now, there's a reimbursement component to it, and hopefully that both doesn't start getting squeezed faster, that allows the innovation to happen. And if you do what is sustainable and scalable, you can continue reinvesting back into innovation. And I think that that's also part of the healthcare challenge, is that because of the way it gets financed, the innovations have been pretty much funded by those who have. Even when you look at some of the digital components out there today, much of them serve individuals who have a high value for their time, and therefore are willing to go outside of the traditional mechanisms of healthcare to go seek out-of-pocket care, concierge services, digital, dermatology, women's health. I mean, you can go down the list of places where people are willing to spend out of pocket. And so that has funded much of the innovations thus far. But as a society, I think value-based care and aligning incentives is a key component.
Yeah, could not agree more. And actually, there's a number of questions in the Q&A about this, that sort of dig into these topics a little bit more that we'll get to in a moment. Sally, I'd love your thoughts, though, before we do that.
Yeah, I couldn't agree more with Arvind and Janali. It's really hard to say anything else. So it's just the focus on that seamless experience and seamless care. A couple of things I know that I saw in the questionnaire and so forth, that there's questions on why is Best Buy even here? Didn't know Best Buy was in health and so forth. But our purpose within Best Buy Health, a division of Best Buy, is to really enrich lives and save lives through technology and meaningful connections. And how we're doing that, we're being customer obsessed. Of course, digital first with all the technology, but then also human delivered too. And so I feel that in an age where you can really take the human out of things, and it can be all systemic and all technology driven too. It's like making sure that we've got empathetic humans on the other line too, to help people through it, through if they're having traumatic experiences, if they're maybe just not as technology savvy as others are, and so forth. Like, that's another thing too, that's helping with that seamless experience. And so seamless can mean a lot of things, and definitely through technology is one. How can we connect payers and providers and patients all together through technology? But there's also that human connection throughout as well that's really going to help the consumer feel confident and trusted along the way. And that's what our goal is within Best Buy, and how we're continuing to strive above the challenges we've had.
Yeah, that's really well said, Sally. And I'll just say it personally, I'm glad that you're here, because it takes it takes a very non-traditional set of participants to bring new innovative thinking to solving this problem. And so I think it's wonderful that Best Buy is part of this conversation. So I'm going to go to a couple of questions here. We've got time for just a couple before wrapping up the panel. There's one here that I particularly like, and it speaks a little bit to something that each of you said at some point in time. But this question from David Cook: how does the group envision combining medical and non-medical innovation to deliver care?
I think that's a great question. And I think health systems are recognizing this as well. If you were to speak to some of the leading health systems, even in the metro area, you're going to hear a lot more about the fact that they don't want their focus to be purely on clinical care alone. Or for that matter, from a dollars and cents perspective, they don't want their revenue to be purely patient care driven. They are looking beyond that, diversifying in a variety of ways. And most of those have to do with the whole person aspect of it, investing in the communities, identifying social determinants of health that can actually be influenced by the health system. Behavioral health is a large part of their focus as well. So I think you're going to see health systems recognize the need to diversify revenue streams, so to speak, and in part through that kind of deliver on their commitments to whole person health. So it's something that is going to be driven as much by dollars and cents related initiatives, as well as a mindset around you can't do one without the other to an extent, and at least not effectively.
But even in what you said there, you talked about health systems, but really this conversation is broader than health systems. Again, thinking about the people we have on this panel who aren't traditionally part of the healthcare system, at least not in what many of us think. It takes different players at the table than our traditional care providers. So Sally, I saw you pop off mute to add.
Yeah, just to add on to that. And so some of the things that we're focused on are that we believe that we can enable more so is we've built up a great supply chain network throughout the country. We've got Geek Squad services that can do a lot of things in your home, from assessing connectivity to putting up TVs and so forth. If we can train and have skill sets to help within the healthcare, we can get this product, these services into the homes much easier. That maybe health systems today just don't have the access, the network, the availability, and so forth. And so that's one of the key differentiators, key things that we think we can do and utilize our supply chain networks, our Geek Squad services, to be able to offer these things in the home that wasn't traditionally. So how do we partner with health systems to be able to provide that service for the patient, for the consumers, with a much better care? There's nuances, of course. There's a lot of HIPAA and FDA regulations and so forth, and so there is different avenues that we go, but largely we can piggyback off of what we've already built today. And so that's where you have non-medical, medical coming into play, and how we're delivering into the home.
I foresee a full inbox for you with people interested in having new partnerships.
Yeah.
As a result of this conversation. Janali, I'd love your thoughts.
Yeah, I think that I would say that similar to what Sally said around Walmart, the same, we have 150 million people that visit our physical stores every week. We've got over 60 million people that come to our websites every week seeking information, products, etc. What makes this medical non-medical combo really powerful is that it seems like we've covered it like 15 or 20 times. Hopefully it's sticking with everyone at this point, and this is a big takeaway, that clinical care really makes up such a small component of care. 70% of it is social, it's behavioral. It's all encompassed in trust. You cannot get engagement without the humanity and the trust, right? And so I think it's really critical that as we entered into healthcare, Walmart entered into healthcare, and we thought about we want to be bigger. and we want to serve our communities to have affordable, accessible care. One of the reasons we believe that we can win, and we continue to believe we can win, is because of the non-medical aspects as much as the medical aspects that are out there. We also believe that we don't have to build all the parts of the ecosystem on our own. There is so much innovations happening out there. It is a matter of providing scale and the ability for these innovations to go to a broader population than they currently serve. And so it is everyone working together. And this is the piece that I think we're going to continue seeing a trend on as we go forward. Individuals that typically have seen themselves as competitors are going to be cooperating a lot more, because we're all seeking the same aspects. And as healthcare and the conditions of people are becoming more complex, everyone, including traditional players, are coming to us at Walmart and saying, help us reduce the cost, help us get access. I met with a payer group recently in a particular state, and they say to us, can you help us identify moms who are pregnant? Because over 50% of the time, the first time I find out that a mother who is a member of mine is expecting is when she shows up to the ER to deliver. And so I share that example to say that there is going to be lots of innovations, because they are having issues with having high-risk pregnancies. They're losing moms and babies. And they're trying to now figure out, how can Walmart help me when they're buying a pregnancy test? And we're on that journey with them to figure out, mom is in our store, she's buying pregnancy tests, she's talking to a pharmacist, she's talking to somebody in the store. How can we connect the dots so she knows what her benefits are? She trusts the system. If that is why she is not engaging in healthcare, is because she doesn't feel respect and have dignity when she engages in the system. How can we be that conduit, because we know we have trust with her already? And so I think that those are like, it's not going to happen in a big bang theory type of a way. It is really going to happen innovations of this nature, where we identify the highest challenges that we're having. Like, for example, as a country, we have the worst mother. If you're a mom and if you get pregnant in America, you are at a way higher risk, regardless of your socioeconomic status, than any other developed countries. You start getting into other races and lower socioeconomic status, it even gets worse. And that is unacceptable for a developed country. And there's lots. So I think this is how medical and non-medical start partnering, is by looking at those use cases or those really critical times and poorest outcomes that we're getting, and figure out how we all play to create solutions that actually think about the whole person, and not just what my incentive is of participating in the person's care journey.
Yes. Well, in fact, there's a wonderful question from my dear friend Jim Willenbring in the Q&A about how can this consumer-oriented approach to healthcare better address health disparities, which is along the lines of what you're getting at. We don't have time to go into it in great detail, but Janelle, I know this is a passion area for you. If you don't mind saying one more word about the direction that you believe we can have an impact here, and then we'll go to wrap up. So, think about how this consumer approach can help with disparities.
Yeah, I think what I would say is that, again, I would just double click on the point of partnerships. I think that there's many factors why health disparities are out there. Partly it's because of lack of access, but it is also part of trust that is causing us to have the issues that we have. And so there isn't a one bullet that fits all, or a one solution that fits all. The hyperlocality and the identification of who the right partners in each community are to engage some of the community members that need care the most. And care comes in the form of social needs, comes in the form of behavioral needs, comes in the form of medical needs, is really critical. And no one can sit on a high chair and say, I, Walmart, am going to go do it. It's impossible. You've got to figure out who has the trust of the community. In some cases, it's an alderman. In other cases, it's a church. In other cases, it could be the Department of Health or Pomodoras, for example, in South Texas. that are critical to making that connection. And so I think it is a matter of partnerships, not just at a business to business perspective, but also partnerships with the local community organizations.
Yeah, wonderful. Well, I hate to say it, I cannot believe how quickly the time has flown. We have to wrap our discussion now. But so what I would appreciate is just, one or two closing thoughts from each of you on this around your vision for the future of a consumer-driven healthcare. I guess let's start with Sally, then we'll go to Janali and Arvind. I'll give you the last word.
My vision is that we're going to get there faster than we've ever thought we would. Technology's moving fast. Everybody's so engaged around this. And I just think that it's going to be a wild ride, but super excited to be on this ride with all of my counterparts here as well. But we can change how healthcare is in America today, and can't wait for it. So I'll work just as hard and fast and furious as possible to improve this going forward for all of us.
You have definitely inspired me. Wonderful. Thank you so much, Sally. Janali.
Yeah, I would say the acceleration is going to be exciting. The partnerships that we will form and build through this process, it's just great to see that everybody is on, be it Best Buy, be it Walmart, many non-traditional organizations are starting to participate in creating and the value chain of healthcare to be better for the consumer and for the system. We spend way too much on our GDP. I would rather that America start spending a little bit more on education than healthcare by reducing the waste. And so I think that I'm excited about having partners across all aisles and seeing the acceleration. And it's great to be part of this. I hope that each of you feel accountable to changing healthcare in America, and that when you sit on your rocker, 20, 30, 40, depending on what your time zone is, if we failed, it's because all of us who participate in this ecosystem failed the people. Many factors are, the eye is hot right now, and a change will happen here.
Yeah. Mission received. Count me in on this journey. We can sit in side-by-side rockers and look back on our careers, hopefully, when we get to the end of this.
Mission
Wonderful.
received from the academic group here as well as with Bach as well. This is exactly the kind of conversation we want to have in launch on the mission with industry partners and community stakeholders.
Good. All right, Arvind, closing thoughts from you before we transition to our next.
So I'm inspired by the vision that both Sally and Janali laid out. I think the one thing I might add is I think the acceleration is coming, but most of all, my vision is that this is going to impact the demographics that need it the most, whether it's Medicaid and our senior population, which is fast growing and most in need, or it's Medicaid and children and individuals that are below a certain threshold of socioeconomic means. I think the innovation is really going to be most impactful there, and at least the way the demographics are set up, all the players are perhaps most incented to impact that population, which to me is actually a good outcome. So I don't think this is going to be led by purely the commercially insured, well-employed individuals. I think this is going to be a focus on the Medicare and Medicaid populations, which is a true win. So excited.
Very well said. And I'm thrilled to have partners like you working to solve these problems. So thank you so much for your time this morning, Arvind, Janali, Sally, Pinar. I will turn it back to you.
Thank you so much to all of you. Again, this was such a fantastic panel, and I took so many notes as you, Amazing. I was like, I have to follow up with Arvind. I have to follow up with Sally. I have to follow up with Janali. So thank you so much for this engaging conversation, and we will follow up with you. And now we will take just a 4 or 5 minute break. Let's come back for our executive spotlight at 10:50, 10:52. We will start our executive spotlight. Thank you so much.